Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, how to sign up for CARE, a program that helps you care for a loved one with signs of Alzheimer's. Then, we're going for the gold. See how you can win a gold medal smile without a trip to London. It's all hands on deck to create a cool craft. Plus, we'll get the skinny on keeping our skin healthy. And how a little-known veterans benefit can protect your home from the nursing home and Medicaid.
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Your loved one has Alzheimer's, and you're already overwhelmed with concerns and questions. Nurse Karen White can offer help. Karen is with Home Instead Senior Care, and she teaches the Alzheimer's class that can help you handle this hard job. It's a terribly hard job, isn't it?
It's very, very difficult. You're right. Our acronym CARE stands for Changing Aging Through Research and Education.
So you've got a course that does this, right?
We do.
Tell us about the course.
We do. We have 4 sessions, and the first session focuses on what I call the nuts and bolts of Alzheimer's disease and other dementia. We go through the causes, the different types, and just how immensely prevalent the disease really is. For example, we discuss what happens to the brain physically in the fact that it develops those plaques and tangles, and it really actually loses weight. We look at the symptoms, including memory loss, difficulty completing tasks, problems with planning and problem solving, poor judgment, and withdrawing from social activities. And with this, when they withdraw from social activities, they really know they're losing ground, and they do that to cover that up.
Okay.
I also know how important it is to be evaluated by a physician to make sure that they have a definitive diagnosis of dementia. Some of the other causes that can cause the same symptoms would be a urinary tract infection that's untreated, some thyroid problems, and even drug interactions.
Yeah, I've heard from a lot of people about the UTIs that really can cause a change in your personality.
Absolutely.
What do you share with the loved ones as to how the disease how it progresses? You know, what's a normal course?
Right. Well, it's really helpful to keep in mind that we divide dementia into 3 stages, and we want to look at the cognitive ability of what those people with dementia have at those particular stages. The first stage, they cognitively have the abilities of an 11 or 12-year-old. So, for example, knowing that it's difficult to balance a checkbook for a 12-year-old is difficult for them to now continue to balance their checkbook. In the second stage, they have the mindset of a 5 and 6-year-old. And in that third and final stage, their cognitive abilities are of a 2 and 3-year-old.
Like a toddler.
So it really is. And so we see behaviors like kicking and biting and hitting and spitting.
You should think back to your own kids and bringing them up, all what you had to go through. So.
Absolutely.
Well, how can a loved one prepare for this kind of a challenge?
Well, first, one of the things that we do, and it's our second session, and we create what we call capturing life's journey. And what this is we involve the family and other important people in that person's life to give us a background and a history of what they liked and what was important to them, asking open-ended questions, where they grew up, and special memories they can have. So, for example, maybe they played the piano, maybe they were a competitive swimmer, or even having been a great cook. So having this information, the family and the caregivers can better relate to them. And they can also use this information when things sometimes can get out of hand. They can use that information to bring them back.
Can you give us an example of what you mean by that?
Absolutely. Let's just say, for an example, the person is really becoming frustrated. Maybe there's something that is in the environment that's really causing them frustration. So one of the things we recommend is to say, why don't we go ahead and watch that golf tournament, knowing full well that they loved golf and they were avid golfers when they were growing up.
How about making choices? I know you need to give them respect and still let them have some say in life.
Absolutely. And one of the sessions that I do is the third session, and we look at the techniques to manage difficult behavior. And one of the techniques is exactly what you said. And that's the first one, to just give them simple choices. For an example, just saying something as simple as, would you like turkey or ham today? Do you want to wear your black or gray sweater? Because too many choices become very overwhelming for them. It's just too much. So really want to make it very simple for them. The second technique is apologizing or taking blame. Many times it's not the caregiver or the family's fault, but just to go ahead and say, I'm sorry that we've misplaced your purse. Let's go ahead and find it. I'm sorry it's frustrating for you. Really takes a lot of the heat off the situation. The third technique is to redirecting them, changing focus, and that's a little bit about what we just talked about.
Right.
Just kind of redirecting them and using the information from the journal completely helps. Finally, the last technique is to either physically remove an item or that person from the environment. For example, if there's a painting on the wall that's really causing them frustration, I recommend taking that down, putting something up that's a little bit more pleasant for them. And if it's their environment, really removing them and just saying, let's go for a walk. You loved it outside. Or why don't you show me how to paint because you were such an avid painter. And really that helps them change their focus.
These are all such amazing tips. I wish we could talk more about it.
Oh,
but
I wish we could too.
We know that caring for a loved one with Alzheimer's also means caring for yourself too. And one way is to take the class that Karen teaches. To learn more, use the information that's coming up next. My thanks to Nurse Karen White for joining us today.
Thank you.
To learn more or to receive a free booklet, Helping Families Cope, call Home Instead Senior Care at 440-734-7441. Also, check out this website, www.helpforalzheimersfamilies.com. Next, on your mark, get set, smile! But first, here's a pet research project for you. This sweltering season is dubbed the dog days of summer. But how did man's best friend get leashed to the heat? We'll look to the skies for the answer and see who was barking up the wrong tree when we return.
Sometimes it's about beating the clock. Sometimes it's about beating fate. And sometimes it's about beating the unimaginable. But there's one opponent our team loves to beat more than any other. We love beating the odds. We are the Metro Health System. We are the proud sponsor of the comeback.
The star of the dog days of summer is Sirius, the brightest light in the constellation Canis Major, or the Big Dog. Dogged in their pursuit of why the weather was so warm, ancient Romans noticed Sirius rose and fell when the heat was turned on high. So doggone it, they blamed that star for their climate conditions.
The Olympics are just 2 weeks away, and when they award those precious medals, we're sure to see lots of winning smiles. Could your grin capture a gold? Can your smile finish first place just by maybe brushing up on a few training tips? You can do it. Dentist Steve Marsh is here to coach us. So let the games begin.
Thanks, Lori. And I wore a red, white, and blue tie in
Oh,
honor of the Olympics.
U.S.
Thank
Yeah,
you.
we got to cheer on the U.S. Well, gold medal still represents the best of the best. Is gold still the best metal for your teeth?
Very cute. Actually, and I have an old gold crown here, and I'm going to hold it up for you. Gold is still a marvelous restoration. We use it mostly in the back teeth. Obviously, it doesn't look very good, and the price of gold has made it almost unusable today. And so that's what's happened. We used to use gold a lot. It's still, again, if it's holding up and the patient's fine with it, that's okay. After gold, we then went to these combination gold and porcelain ones. I'm going to hold it up here for you. This is porcelain on top of gold. It limits the amount of gold and made it look better. That's the second type of crown we used to use. And today, I'm going to bring up this last one. Hopefully it'll stay up. It's all porcelain. And so that's really what we've gone to today to give a beautiful restoration. And quite frankly, with the cost of gold being what it is, it also helps keep the cost down for the
I
patient.
imagine that would be a lot. So if gold isn't coming in first place anymore, does silver, move up in the rankings?
Well, unfortunately, silver is still way below gold. And today in my practice, for example, we haven't used silver fillings for 15 years. Silver, actually, if it's holding up well, we'll generally still keep it. Once it starts to break down, we'll use composite, a tooth-colored restoration, or we'll use porcelain. There's another problem with silver, Lori, and I brought these capsules. These are capsules that contain the materials that we use for silver filling. Half of it is pretty much mercury, and the other half is silver. Well, we know mercury is not good for the environment.
Not good for people either,
Not
right?
good for people either. So we've gotten away from it. And when you use silver fillings, the dentist has to cut away a lot more tooth structure. So we want to be more conservative, and that's where composites have done great.
Okay, and we talked about mercury being bad, so if that's an issue, should we be pulling out those silver fillings?
Well, again, when they start to break down or the tooth starts to break, or in some cases when people obviously don't like the appearance, this is a before and after that I did recently on a patient. It's an old silver filling. It broke around the edges. When that happens, it leaks. It's just like a window. Windows themselves don't leak, but it's always around the outside. So there was some leakage fracturing. We took it out. We replaced it with a composite filling. It was done quickly. The tooth lost the gray color. So composites are really a wonderful material. And we have some pictures of other people we've treated.
Okay.
Since we were doing this gold, silver, bronze situation, I thought I'd show you a patient who came in with all of that. What's interesting is she took care of her husband for about 5 years with dementia. You just finished that in the last segment. And so she let herself go. She came into my office. She had an old partial on the bottom. You see the hooks. Today we do those without metal. We took off all that old dentistry, which was a combination of gold and metal and silver, and replaced it with all porcelain work in the uppers. And then again, the bottom is a combination of porcelain front teeth and in the back. Somebody else whose teeth had stained, she hated the silver fillings, and her grandkids said to her, "Grandma, we don't like the way your teeth look color-wise either." So we took out the old silver fillings, took out the decay, which is very important, has to be done, replaced those with porcelain crowns in the back, and in the front where they had discolored, we used porcelain veneers. So today's, with wonderful materials, gold and silver are really a thing of the past, and I think we look for aesthetics today, and we look for conservative treatment, and that's where some of these materials really have taken over.
All right, always good information. So for a winning smile, no metal or metals required, you can have your teeth triumph by giving Steve a call. His number is next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, easy yet imaginative artistry. Looking for places to go, things to do? Welcome to our community calendar. There's a unique way to brew up interest in environmental awareness. It's called the Burning River Fest. Promoted as good cheer, good cause, good beer, the event features live music, fresh local food, and educational exhibits. Access the activities July 21st and 22nd at the Coast Guard Station at Whiskey Island, and dig up more information at www.burningriverfoundation.org.
Do you have a drawer that's holding hankies you've been hanging onto for their sentimental history? Then get ready to discover how to breathe new life into those timeless treasures. Creative goddess Vicki Odell is here with a sweet-smelling idea to share. Welcome.
Hi.
I have a box very similar to this with hankies in it.
Well, I was recently helping to clean out my mother-in-law's house, and I came across this really great little keepsake box, and it was full of lovely little hankies.
I have the same one, almost.
Do you? Mm-hmm. So I decided that in order to kind of spread them around and share them with the family, that I would make small scented sachets with them.
Okay.
So here's some of the other hankies that I found. Some of them have really sweet little embroidery, and who wants to just, give that away
Somebody
or throw it out?
spend some time doing those.
I know, a lot of time. So the first thing you want to do when you clean out the stash of hankies is to get them all laundered. Sometimes they'll come out all nice and pretty and white like this, but sometimes you just really kind of can't make them look all that great. So what I do is I make a batch of really strong tea. And I soak them in the strong tea, and I give them sort of an overall darkish look. And that way it just looks like I meant to do it.
Exactly. Perfect.
So then, to make the sachets...
So that's an example, huh?
That is an example. Look, this has got a bunch more really lovely embroidery on it. To start, you look at your handkerchief, and if there are stains that you need to cut around or little pinholes, because sometimes this fabric is very thin and it'll get a small hole in it.
It's old.
Right, yeah. So you can cut around that, and then you sort of figure out what the size of your finished sachets can be. These 3 pieces came from the same hankies. So the first thing you'll do is you'll cut it to size. and then you'll embellish the front. I put a little rickrack and a button on it. On this one I have some ribbon, and on that one I even used a small doily from the craft store.
Oh, and you've got a few tied together. How
Yes.
nice. Yeah.
Presentation is everything.
It's everything, huh?
So what you'll do is you'll dress the front of it, because you really can't do that once it's all stuffed. And then you'll put wrong sides together, or right sides together, I'm sorry, and pin it. And you can either take it to the sewing machine and stitch it, or you can stitch it by hand. It's up to you.
Oh, sewing machine's so much easier.
I know.
I see that's what you did, so.
Yeah, that's what I did. I did 1/4 of an inch seam allowance all the way around, and I left a hole right here.
For stuffing.
And, well, the hole is to turn it right side out
to
again.
turn it, yeah.
Right, and then you'll give it a little press, and it'll look something like that.
Okay.
So then...
We got to stuff them.
I gotta
right?
stuff them. I do. So here I have this big jar of lavender, and you want to use whatever herbs that you prefer. The nice thing about lavender is it kind of keeps away moths and spiders.
Oh, and it's soothing. It's supposed to be nice and
Right, so you
calming.
could put this under your pillow at night if you were maybe having a hard time sleeping. It would help you relax and calm down. So you can use anything that you like. You can use catnip if you want, but don't go for a walk.
Oh, true.
You might get attacked by all the neighborhood cats, right? So as long as it's thoroughly dry, because you don't want any moisture in your
that
drawer
would
or
ruin
in
it.
this, and it
Right.
would just kind of ruin the whole thing. So if you want, I'm going to let you fill this, because
Well,
I've
fill it a
done
little bit.
Well, here's a spoon. That'll make it a little bit easier for you.
Okay. Why don't you push, I hold.
There you go.
Okay, so we're just going to fill them up like that.
And then you can
Excellent.
use this until you get it as full as you want. And then you do it over a little piece of paper like this so that you can collect
Put it all
everything
back.
and put it back in. That's
idea.
right.
All right.
Okay, so
A
then
nice-
once it's full,
Just stitch it together with
yeah.
some
And I always
needle
use
and thread.
sort of a little bit of a bigger stitch so that I can take it out later and replace.
Good idea. Excellent. Always good ideas you've got there. This design is sure to delight since it is aromatic art. My thanks to Vicki Odell for joining us. As you've seen, her craft talent is nothing to sneeze at.
Discover more craft ideas at www.vickyodell.com. Next, does your skin have a healthy glow?
It's time to get up and go. An exercise minute on golden opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and today we are going to work all the muscles in our legs, glutes, hamstrings, and quads by doing a basic step exercise. This is an excellent exercise that will help us to maintain mobility. All we're going to need is a basic step. We got some dumbbells here. You at home, any step that you feel comfortable stepping on will work. We're going to start with our right foot up on the step, and all we want to do is simply extend that leg up, take a little step, and then right back down, okay? So all the way up, all the way down. Remember to breathe, slow and controlled movements, and take your time so that way you don't stumble. Okay, we're going to go ahead and switch sides now. Let's do a couple with the opposite side. Up. Okay, right back down. Great job. Now you can bring a little more aerobic activity into this one by simply speeding your pace a little bit, okay? And now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
Every summer season, we fancy fun in the sun. But while we love to lighten up, the sun can cast a dark shadow on our skin's health. Dr. Elliot Love is here to shine the light on ways to protect yourself from developing skin cancer. Dr. Love is a dermatologist with Metro Health. Welcome to the show.
Thanks so much for having me.
I know I got problems with the sun. And for those of us of a certain age, a lot of times we've already caused a lot of damage in the past. Do we still need to worry about sunscreens?
Right, you bring up an excellent point. A lot of the damage that we get from the sun we acquire at a young age. Usually by age 18 we get the majority of it. But that being said, the statistics are pretty staggering. They estimate by the age of 65, about half of us are going to get a skin cancer. So every little percentage of protection you can get is very important.
It'll help in the end.
Yeah.
All right. Well, we've got SPF and UVA and UVB. It's like an alphabet soup.
Right.
Can you really spell out for us what we should be looking for?
Sure. So to kind of spell it out and make it simple, SPF just stands for sun protection factor. And that's exactly that. It's the sun protection factor that the given product gives. There's three UV lights. There's UVC. UVC is blocked by the atmosphere. We don't have to worry about that. But when you're getting an SPF, a sunblock, you want to make sure it's broad spectrum. because the two that get in, UVA and B, those need to be blocked. Those can be harmful to our skin.
And how often do you have to put it on?
You need to apply it, if you're going to be out between the hours of 10 and 4, it's good to apply it every 2 hours. And you have to apply it generously, don't skimp.
Okay. And how about when it's name brand, versus store-bought? Is there any difference between the two?
It's a good question, one a lot of patients ask. There really is no difference. Consumer Reports, they put out that the store-bought brand can be just as good as the name, more expensive brand. I tell my patients, just wear the one that feels more comfortable for you, because if it feels good on your skin, you're more apt to wear it.
Okay, so what if we do find something on our skin that looks kind of strange, kind of worried about it? How do we tell whether it's worth a drive to the dermatologist?
Right. I think an easy mnemonic to remember is A, B, C, D, E. If you look at something in A being asymmetric, it doesn't look even, that would kind of raise a red flag. B, your borders, if you look and there's some irregular borders. C being the color, not so much light or dark, but if there's multiple variations of colors, purples, reds, loss of color, that can be a warning sign. D, diameter, anything larger than a pencil eraser. And E, evolution, or just change over time. You've had the spot for a year and you've noticed, over the past 6 months, it looks a lot different.
So just keep watch on those kinds of things, huh?
Exactly.
All right. Is it worth coming in annually for a checkup of everything?
Yeah, I think just like going to see your general family practice doctor for your routine physical, I think it's a good idea, especially if you have a significant sun history, to come in once a year to get looked at. And then obviously if you have a cancer, you see us more.
Ooh, but what if it does turn out to be cancerous? What are the options?
Well, first, if there's a spot that we're really worried about, we'll just biopsy it, which just basically involves taking a small little piece of the skin. We get it tested, and if it is a skin cancer, depending on what type it is, usually it could either just be destroyed, or if it's more aggressive or in a cosmetically demanding area, we surgically remove it.
Okay, and you told me about a type of surgery called Mohs, I guess. That's named for the person who invented it?
Correct.
So what is that?
Correct, Mohs surgery.
Oh, Mohs, okay.
Mohs is, it doesn't stand for anything, it's the guy's name, and what it is, it's pretty much the most efficient way to treat a skin cancer. As you can see here, the young lady in the before picture, she unfortunately had a little spot there right under her eyelid. And what the Mohs surgery involves is we numb it up. It's all done with local anesthetic, and we spare the most amount of normal skin possible. So we only cut right around that little area that you see.
And it's gone.
And when exactly, it's like a little magic eraser. It's gone.
That's fantastic. Good information. So for us, when it comes to your skin, you can let the sun shine in. Just be sure to enjoy the sun safely. And if you see some kind of irregularity on your epidermis, schedule a checkup to check it out. My thanks to Dr. Love for joining us today.
Thank you.
For more information, call Metro Health at 216-778-DERM or log on to their website, www.metrohealth.org/MOHS. Next, a little-known strategy to protect your home from nursing homes and Medicaid.
Hi, I'm Trapper Jack at Nelson Vein Clinic, where varicose veins just fade away. Barbara is here. How long ago since the procedure?
3 weeks.
What did you notice right away after Nelson
It's
Vein
all
Clinic?
gone.
Pressure was gone?
Oh, it was all, yes.
Pain's gone?
Yes.
And it's covered by insurance.
That is one thing that got me here. That was a big relief. She's very good at what she does. She's terrific. You can hug her like I did.
Isn't it time you took care of your varicose veins? Call or log on to nelsonvein.com.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then we'll be back to tell you a secret to securing your home sweet home when your spouse enters a nursing home. A few weeks back, we talked about how veterans often miss out on huge financial benefits because they just don't know about them. One of the best is called Aid in Attendance, and it can be worth as much as $20,000 a year to you. But if a veteran is in a nursing home, won't those great benefits just go right to the facility? So why bother? Here to reveal the surprising answer is my law partner, who's hard to surprise, Mike Solomon.
Hey, Lori.
Hi, Mike. So, quick recap. What is Aid in Attendance?
Well, let's say the spouse in the nursing home is a veteran, and you're starting to spend down assets. If you get below $80,000, the veteran could get up to $20,000 a year in aid and attendance benefits.
Okay, and it's available for the spouse too, if
That's
they
right.
happen to be
That's
the one.
right.
When your assets get that low, I mean, you eventually qualify for Medicaid, and when you do, won't that $20,000 of added income just be paid to the nursing home?
Well, yes and yes. Basically what happens, if you do qualify for the VA benefit, the money comes in, and it has to go to the nursing home to pay down the long-term care expenses. And that relieves Medicaid of the problem, but it does just go to Medicaid, so you don't get that money back.
Okay, so...
Except you do get $90 a month out of that.
Okay, a little extra than
little
Medicaid
extra
would allow
for
you.
yourself.
So why would we bother even to apply if most of the money is just going to disappear?
Well, you're right, most of the money disappears, but here's the issue. If you're getting that $20,000 benefit from VA, that money goes to help reduce the cost of the nursing home, and therefore reduces the amount of the money that Medicaid pays for the nursing home.
And that's important. Why?
That's important because you have something called a state recovery, and when the spouse in the nursing home passes away, the state of Ohio has a right to go after the estate and try to get all the assets that they use to pay for your Medicaid. So this will save you potentially losing, let's say, your home on the death of the spouse in the nursing home.
Okay, more VA, less Medicaid, less payback.
That's right. That's right.
Good tip.
Yes.
During their military careers, veterans protected our country's home front. Now we're giving our veterans a chance to protect their own home fronts. Try using the Aid and Attendance benefits to avoid losing your home. For more information, give Mike Solomon a call.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.budishandsolomon.com.
Thanks for joining us on next week's show, Juggling Investments and Taxes. We'll get into the swim of things at the Greater Cleveland Aquarium. Are your bones ready to break? We'll prescribe a fix for your fragile frame, and we'll serve up some sweet snacks that are super for summer. Until next week, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.